So my name is Abraham. I'm a pharmacy resident at Stanford right now. And then together with Yoon, we've worked on this presentation about the potential benefits of herbal and dietary supplements. So first, I'll kind of give an overview about what the definition of a herbal or dietary supplement is. Go review some of the common misconceptions about these supplements, and then review some of the commonly used supplements. There's thousands of supplements available on the market, but I'll just review some of the top, like about 15 that are commonly used in cancer patients, including like what the recommended doses are, what they can be used for, and then what are situations that you should avoid using those supplements. Quickly go over some other forms of alternative or complementary medicine, and then have a summary. And at the end, I'll have some other resources online where you can go and learn about some of the other supplements. So what are dietary supplements? They are defined as vitamins, minerals, herbs, products made from plants, animal parts, and yeasts and extracts. The FDA regulates them differently from food and drug. So drugs have to get FDA approval before they get put on the market. However, with dietary supplements, they get put on the market before FDA approval. And the FDA only really steps in when a problem is reported. They're sold over the counter, however, differently than over the counter medications. They also don't get regulated like over the counter medications. Drugs are usually considered unsafe until they're proven safe to the FDA, while dietary supplements are considered safe until they're proven unsafe to the FDA. And this can make things a little difficult. So while most supplements have clean, safe histories, there have been some reports that there has been some contamination in some of the herbal and dietary supplements. For example, recently they found some supplements have been found to be tainted with pesticides, heavy metals, and prescription medicines. For example, a few years ago, there was this male enhancer that was sold at your local pharmacy, and then they found that they actually contained Viagra or Cialis. And then the FDA, this is dangerous because it doesn't state that it actually has those medications in it, so that patients may have taken it unknowingly and have some other side effects. So the FDA eventually stepped in and took those medications, those supplements off the market. In 2013, there was a study done in Toronto that found that out of the 44 herbal supplements, including supplements from Canada and the United States, about half of them didn't actually contain the herb on the label. They contained some other substitution, or they just contained filler. So the best way to avoid this is probably to avoid products that claim to work like prescription drugs, because they might actually contain some prescription drugs. Also, you can avoid products that are advertised through mass emails, products that are marketed in a foreign language, and products that promise weight loss, bodybuilding, enhanced sexual performance, and then other products that say they're legal alternatives to steroids. Some of the common misconceptions of herbal and dietary supplements is that it's natural, so it must be safe. Well, not necessarily. So the first example on the left is a mushroom. It looks very similar to mushrooms that you buy at Whole Foods or Safeway. And however, it's actually quite poisonous, and there's been many reports of patients or people going out and collecting these mushrooms and then cooking them and then ending up in the hospital because of toxicity. Tobacco, we all know, is a very natural substance, but it's used in smoking, and we know all the harmful effects from cigarette smoking, including heart disease, lung disease, and also cancer. The third one is the castor bean. So it looks pretty harmless. It's just a bean, but it actually contains a chemical called ricin in it. And about 5 to 20 of these beans can kill an adult human. So in the 1970s, the KGB actually used the extract from these beans and assassinated people. So it's natural, but it's also dangerous. And then the last one is ephedra sinica. It's also known as ephedra, and it used to be sold as a dietary supplement in the United States, and it's like kind of a performance enhancing, gives a stimulant effect, and many athletes used to use it. However, in 2003, a famous baseball player actually died from using this herbal supplement, and then the FDA went through the data and found that it was because of the ephedra that he had a cardiac event and it led to his death. So because of this, the FDA has banned ephedra in the United States. On the flip side, many chemotherapies are also come from natural sources. So for example, vincristine is sourced from the Madagascar periwinkle. Vincristine is often used in leukemias and lymphomas, and they can cause nerve pain. Cytarabine is from the sea sponge, and it can really decrease a patient's blood counts. And paclitaxel is used in many chemotherapies, like for breast cancer, and it comes from the Pacific yew tree. So even though these are natural substances, you know that chemotherapy has a lot of toxicity. So while they may be safe as a plant, once they become concentrated, it can become dangerous. Another common misconception is that more is better, and this is also not necessarily true. For example, some people recommend taking a lot of vitamin C. However, they found that actually taking too much vitamin C can interfere with the absorption of copper. And copper is important for making red blood cells and also for nerves. They've also found that taking too much phosphorus can interfere with the absorption of calcium. And calcium is important for having strong bones and also to stabilizing the heart rhythm. What's important is that the safety and the dose of whatever you're taking are related. So when you're taking the leaves and a root of a plant, it may be safe in small amounts as a herb, but now they sell all these concentrated pills as extracts, and they may contain very high concentrations, which may not always be safe. In 2012, the FDA did receive 2,800 reports of dietary supplement adverse effects, so they're not necessarily side effect free. In 2011, the U.S. Poison Control Centers received over 35,000 calls regarding dietary supplements. So what I want to make sure you all understand is the appropriate use of these herbal and dietary supplements are important, and that the dose is also important for your own safety. So this is a list of some of the common supplements that are often used, and I'll go over the uses of each one of these. There's many thousands of supplements, but through the literature, these seem to be the most popular ones that I'll go over. The first supplement I'll talk about is glutamine. This is an amino acid that's found in our bodies, and they sell it as an over-the-counter kind of powder stuff. And it has been studied to decrease the severity and rate of mucositis from chemotherapy and radiation. Mucositis is basically all the sores in the mouth all the way through the GI tract due to the chemotherapy. Glutamine has also been found to decrease neuropathy from chemotherapy. It's mostly studied with taxanes like paclitaxel and also oxaliplatin. So those are usually breast cancer and colon cancer patients, but sometimes they extrapolate that data to other cancers. The common dose for glutamine is 10 grams 3 times a day, and it can be taken with food. The taste is not very good, apparently, so some patients can mix it with yogurt, and that makes it more palatable. Some side effects from glutamine are that it can cause stomach upset and headache. And then there's a possible interaction with anti-seizure medications. So if you are on an anti-seizure medication, it's probably best to avoid glutamine. Next, I'll talk about vitamin D, also known as ergocalciferol or cholecalciferol. Vitamin D is basically a vitamin that controls the calcium, phosphorus, and also bone metabolism. It's often used to help form strong bones, and usually in combination with calcium. And then a deficiency in vitamin D has also been recently found to have an increased risk in certain cancers. However, the reverse is not well clear yet, so boosting your vitamin D levels not necessarily reduces the risk for cancer, and that's still being investigated in studies right now. The common doses for vitamin D are usually dosed based on vitamin D levels. So some physicians may actually draw your vitamin D level, and if it's too low, they can set up a plan to replace that to a regular level. Usually it's dosed around 1,000 IU or international units a day. And then the over-the-counter tablets are usually 1,000 or 2,000 IUs. Some side effects from vitamin D is that sometimes it can cause stomach upset. And then also if you take too much vitamin D, it can also increase the calcium levels in the blood, and which can lead to kidney stones. The next topic I'll talk about is fish oil. This, or also known as omega-3 fatty acids. These are usually extracted from cod, krill, salmon, or sardines. The potential uses of this is to reduce inflammation, and then some physicians actually prescribe it to help reduce triglycerides if you have a high triglyceride in your blood. There's been some studies looking at it as a way to prevent cancer progression, but there is very mixed results right now, so it's not recommended for that. Common doses are about 2 to 3 grams per day. And then the side effects is that it can cause loose stools because it is greasy, so it kind of makes you go to the restroom. And then it also has a fishy aftertaste because it is sourced from fish. Fish oil does increase the bleeding risk and interacts with some anticoagulants. So if you're on anticoagulants like warfarin, it may increase your bleeding risk. So it's important to talk to your physician or whoever monitors your warfarin. Next, green tea. Green tea is from the unfermented leaves of Camellia sinensis. It's often used as an antioxidant and to help improve cholesterol. And then people drink it because it also tastes good. It's commonly consumed through dietary consumption. And now they do sell extracts of green tea. However, the doses of those supplements is not very clear yet. Some side effects of green tea is that it can cause caffeine-related side effects, like because it does contain caffeine. So it can cause insomnia at night and cause some jitteriness. It can also increase stomach acid, which can be a problem if you have some reflux issues. Green tea does interact with warfarin, so it can affect the INR and the bleeding with warfarin. Green tea also has some interactions with some chemotherapy agents, including bortezomib, irinotecan, sunitinib, and tamoxifen. So in the case of bortezomib and sunitinib, the green tea actually inactivates them and reduces their efficacy, while in irinotecan and tamoxifen, it raises the amount that's in the body, which can lead to more side effects. With milk thistle is formed from the extract of the Silybum marianum flower. The active ingredient in milk thistle is silymarin, and it's often used to protect the liver from chemotherapy damage or other insults to the liver. The common dose is about 200 to 400 milligrams of the silymarin, and that can increase to about the max of 13 grams per day. However, if you do go above 13 grams per day, what usually protects your liver can actually harm the liver. So this is an example where more is not always better. And then milk thistle can also cause some stomach upset. Next, I'll talk about astragalus or huangqi. This is the root of the Astragalus membranaceus. This is a Chinese herbal medicine that's used very often, and it's thought to strengthen qi or energy. It's often used to reduce the fatigue due to the cancer or chemotherapy treatments, and sometimes it's used for kidney protection. And then I didn't list it, but some patients also use it to kind of boost their immune system. There's been some studies, mostly in China, about looking at this astragalus as an anti-cancer agent. However, it's not very well established, and all the studies combine it with chemotherapy, so you don't really know if it's adding much. The common dose is about 10 to 90 grams per day of the raw herb, and you can usually either grind it up and make it a tea or to a soup. And it does, because it kind of boosts the immune system, it interacts with immunosuppressant medications like tacrolimus and cyclosporin. And then they found that astragalus can alter the levels of estrogen in the body, which can be dangerous if patients have a estrogen-driven cancer, such as breast cancer, ovarian cancer, or uterine cancer. The next one is dongquai. This is the root from the Angelica sinensis, and it's often used to help with menstrual symptoms or menopausal symptoms like hot flashes. The common dose is 1 to 15 grams. You can divide it 1 to 3 times a day. The main side effects from dongquai is that it can cause stomach upset, and it does also increase the risk of bleeding and have interaction with anticoagulants. So if you do have low platelets or you're on anticoagulant, it's probably best to avoid this medication. Dongquai also has estrogen activity like astragalus before, so again, it should be avoided if there's breast cancer, ovarian cancer, or cervical cancer. Next, I'll talk about melatonin. This is a natural hormone that's secreted from the pineal gland, but now we can concentrate it into a pill. Melatonin's involved with the circadian rhythm to help with the sleep-wake cycle. So it's often used to help improve sleep and reduce fatigue. There's also been some studies that are looking at it as an anti-cancer agent, but its role is not well defined right now. The common doses are about 0.5 to 3 milligrams a day, but this can sometimes be increased to about 10 milligrams a day. Some side effects you can expect are to have drowsiness or confusion because it's helping you go to sleep. Some patients do report that it causes some itching, and it can also cause a fast heart rate. Melatonin also affects the levels of estrogen, so again, in breast cancer, ovarian cancer, and uterine cancer, it should be avoided. And then probiotics are kind of hot topic now. So it's basically live microorganisms, usually either Lactobacillus, Bifidobacterium, or Saccharomyces. And they can be used to improve diarrhea due to chemotherapy or radiation. So the idea behind this is that you can take these microorganisms that are naturally found in your intestines and replace that to help kind of block out any dangerous other bacteria. The common doses of probiotic, it really depends on the brand, but for example, Culturelle is a commonly used brand. The dose is recommended is about 10 to 20 billion cells a day, and each capsule of Culturelle contains 10 billion cells. And another way to consume probiotics is to eat yogurt, because yogurt does have lots of probiotics in it. Some side effects from probiotics is that it can cause gas, and then it should be used cautiously in patients that are immunosuppressed or if they're neutropenic. So while these bacteria are kind of natural flora in your intestines, they are live organisms, so it can cause an infection if your immune system is low. Ginger, a lot of cultures use ginger in cooking, and basically, it's the root of the ginger plant. And it's been found that it's pretty effective in mild to moderate nausea and vomiting. The common doses are about 250 to 1,000 milligrams a day. And it can cause heartburn. It can also increase bleeding risk, so it's used cautiously if you have low platelets or if you are on anticoagulants. And ginger also antagonizes some of the immunosuppressants, such as cyclosporin and tacrolimus. Ginseng is commonly used in Asian, as an Asian herb. There's two main types of ginseng, Panax ginseng, which is the Asian ginseng, and Panax quinquefolius, which is the American ginseng. The Asian ginseng is more potent than the American ginseng, and they do have different properties that herbalists could tell you more about. They're most often used to help with fatigue due to chemotherapy and also the disease. And it's been found to also help with some diabetes. The common dose is that it's usually taken about 1 to 2 grams per day of the raw herb. And now they do sell the extract. The usual dose is about 200 milligrams a day. Some side effects from ginseng is that it can increase the heart rate, which can be dangerous if you have a history of cardiovascular issues, such as a prior heart attack or if you have coronary artery disease. It can also cause insomnia, and then it does decrease the blood sugar. So if you have low blood sugar, it might make it too low. Ginseng also does increase bleeding time, and it does have some interactions with anticoagulants. And then they found that ginseng also has increased estrogen effects, so again, it should be used cautiously in those 3 cancers. Next, I'll talk about St. John's wort. This is made from the flower of the Hypericum perforatum. It's been found to be fairly effective in mild to moderate depression. In Germany, this herb is actually a prescription-only drug, and some physicians actually prescribe this more than Prozac. The usual dose is about 300 milligrams 3 times a day. It can cause some dry mouth, dizziness, and stomach upset. However, the most important thing is that it does reduce the effectiveness of many medications, including chemotherapy and immunosuppressants. So St. John's wort increases your metabolism of chemotherapy and clears it from your body faster, so it doesn't have a chance to work on the tumor. So we highly recommend against using St. John's wort, especially while you're on treatment. And if you do have symptoms of depression, it's always best to talk to your physician so that they can work with you to set up a plan for that. Next is the antioxidants. This is a very broad class of compounds that counteract free radicals. This includes vitamin C, vitamin E, beta-carotene, alpha-lipoic acid. It's thought that these have anti-cancer properties, or that they can protect the body from damage due to the chemotherapy or radiation. So some free radical sources are from ultraviolet rays from the sun, from pollution, stress, poor diet, chemotherapy. And these free radicals kind of damage cells and create mutations. So the idea, they thought, was that maybe using antioxidants can prevent them from damaging the cells. So they've done many studies looking at using antioxidant supplements to prevent cancer, as a way to prevent cancer. And with vitamin E, they found that it actually increased prostate cancer risk. With beta-carotene, they found that it's increased lung cancer risk. And with vitamin C, they found that it has no effect on cancer incidence. So looks like it's not very helpful to prevent cancer. And then later on, they did more studies looking at it, looking at supplement use during cancer treatment to see if it could help reduce side effects. So they looked at vitamin E use in head and neck cancer, and they found that it actually increased the mortality in those patients. And they think that this is because that it decreases the effectiveness of the radiation and possibly the chemotherapy. So when you're giving radiation and chemotherapy, you're kind of giving a lot of these radicals to kill the tumor, but with the antioxidants, it actually helps protect the tumor as well as your own body. As a result, the American Cancer Society does recommend consumption through food sources rather than as a dietary supplement because of the high doses found in the dietary supplement. So those are the ones I'll go over, and then there's a quick summary at the end. And the summary is also in your handout. So the first one I talked about was glutamine, and it can help with mucositis and neuropathy. However, it should be avoided with anti-seizure medications. With vitamin D, it's helpful for bone formation. However, it should be avoided if you have a high calcium level or if you have kidney stones. Fish oil can be helpful for reducing inflammation, and then it should be avoided if you're on anticoagulants. Green tea can be used as an antioxidant, and it's also used to help reduce cholesterol, but it should be avoided if you're on warfarin, and then some of these chemotherapies, bortezomib, irinotecan, sunitinib, and tamoxifen. Milk thistle is often used to help protect the liver from various insults, and there's no real absolute contraindication to anything. Astragalus, or also known as Huangqi, is good for fatigue and kidney protection, and then it should be avoided if you're on immunosuppressants or if you have a hormone-sensitive cancer. And then dongquai can be used to help with menstrual or menopausal symptoms, and then it should be avoided if you're on anticoagulants or hormone-sensitive cancers. Melatonin is effective for sleep and to help reduce fatigue, and it should be avoided if you're on hormone-sensitive cancers. And probiotics can be used to help with the diarrhea from chemotherapy and radiation. However, it should be avoided if you have low white blood cells, like with neutropenia, or if you're immunosuppressed. Ginger is very helpful for mild to moderate nausea and vomiting, and it should be avoided if you're on immunosuppressants. And then ginseng should be avoided. It can be used for fatigue and diabetes, but avoided if you're on anticoagulants, if you have heart conditions, or if you have a hormone-sensitive cancer. And then the two we do recommend against using are St. John's wort, because it does reduce the effectiveness of many chemotherapies, and then antioxidants as a supplement form, because its role in cancer treatment and prevention is very unclear, but it does show that it can reduce the effectiveness of some chemotherapy and radiation. And then there are also other forms of complementary medicine, such as meditation, yoga, guided imagery, or acupuncture. And many of these are available through Stanford's Cancer Supportive Care Program. So if you're interested in any of these, you can talk to Holly, and she can help set you up with this. So as a summary, it's always important to ask your doctor or pharmacist or healthcare professional if you're considering using a dietary supplement, because there are some unknown interactions that may possibly be found. There's no supplement that has been conclusively shown to treat cancer, so there's no miracle pill, unfortunately. And then supplements may be helpful as a supportive care agent during chemotherapy and radiation. However, with every supplement, there still are some risks that must be considered. And then these are some other online resources from some very credible societies. So they're also listed on your handout, but I'll quickly go over each of these websites. So can't really see it very clear, but the American Cancer Society website has a section on complementary and alternative medicine. It has a section that talks about these different modes of treatment. And at the bottom, there's a section on herbs, vitamins, and minerals, and that has detailed information about specific herbs and minerals. The National Cancer Institute, or the NCI, has this booklet that you can download from their website, and it talks about not only herbal and dietary supplements, but also other complementary and alternative medicines. And it's a pretty good read, so if you have time, you can download it and read it. The NIH has has a section called the National Center for Complementary and Integrative Health, and it has a section with many topics about research-based info from acupuncture to zinc, so A to Z. It has many different topics. And then the last one is Memorial Sloan Kettering has a very large integrative medicine department. Memorial Sloan Kettering is one of the major cancer hospitals in New York City, and they set up this database where basically if you're interested in about any herb or botanical or other product, you can find it in the index, and then within each product it talks about what they think it can be used for, how they think it might work, what are possible side effects, and when you should avoid using it. And that's all of my presentation. I can take any questions. Oh, thank you.
Is there synthetic fish oil?
Synthetic? No, I don't know. Yeah, there's a lot of, they do source them from like krill, which is kind of like a shrimp type thing, but they're all usually from the sea. Yeah.
Calcium.
Mm-hmm.
I heard if you take too much of it, you don't absorb it, you excrete it. So is it for any of these, or for calcium, do you recommend smaller doses, like several times a day?
It really depends on some drugs. Most things have a saturable level of how much you can absorb, and with these herbal supplements, they probably haven't done enough studies to actually know what that level is. And then with calcium, they do recommend taking it with vitamin D, because the vitamin D does help absorption of calcium. All right, I think you had a question?
What does probiotic does to patients with neutropenic and immune system compromised?
Well, it's just there's a theoretical risk that because your immune system is low, if the probiotics do become mean, they can cause an infection, and that there is that theoretical risk. Yeah.
Actually, we had one patient in neutropenic that we found the infection source is like it's sort of similar. The lactose. Yeah. So we had one case that actually caused infection, but it's relatively safe supplements and other supplements that we promote the patient to use it if they're willing to use it, especially when you have lots of issue with the digestions and with any they have loads of they're on lots of antibiotics and may kill the bacteria and might go for your GI health.
Is there a reason that you separated green tea, which can be used as an antioxidant, and supplements that you can use? On the back page, you said supplements to avoid, and it's this antioxidants.
Yeah, so I think like they probably recommend not using the actual green tea capsules as an antioxidant, but if you take it like as a tea, it's probably okay unless you're on those specific chemotherapies. Does that answer your question?
Because it's more of a food source.
Yeah, because it's one of the, it's like a food source. It's like you can eat oranges, but you probably shouldn't take too much vitamin C as a concentrated tablet.
You said to avoid green tea if you're on irinotecan. What's the reason?
So irinotecan it's supposed to increase the more irinotecan in your body, so it might cause more toxicity from the irinotecan. But I mean, it's just a very small studies, so yeah.
Can you take milk thistle if you have liver lesion?
If I what?
If you have liver lesion that you're being treated for, can you go on milk thistle while you're on treatment?
I don't know if
I think that it's okay to take it, but I wouldn't go over too much high dose, more like use a low dose to support your liver. But I do not recommend a high dose milk thistle.
But should you, I'm on it like 1 week on and 1 week off. So what I've been doing is to take the milk thistle on the week that I'm not on the chemo drug. It's
that's
a wise thing to do.
No dose is like 200 milligrams.
Yeah, it's like the dose that
2 to
he
400.
recommended is like
2 to 400? 2 to 400.
Yeah. Sorry, you were first. Yeah.
What about turmeric as a supplement?
Turmeric. It's
what is it used for? What do you where
So
you
to support the immune system?
I had a patient that were interested in the supplements, but I'm not sure there's good enough data to support that. So the supplements like a tumor, and I would not use it to as an alternative as to conventional treatment.
Oh, no, clearly. You would not recommend it as an alternative to
No.
allopathic treatment?
No.
No, but after treatment,
After
as
treatment?
supporting the immune system.
After treatment, if you are not, immunosuppressed from like previous chemo treatment, probably okay. Just make sure that you talk to whoever, herbal specialists, see any good products they can recommend for you.
So you don't take turmeric during the treatment?
Well, just that we had some patients that they're seeking those treatment instead of
Not
recommended.
instead of, but during.
I don't have any opinion on that. Yeah.
How about aloe vera? Some people drink it, or you may be able to get it as a pill form, I don't know. Is there any studies on that at all and its effect on the chemotherapy?
What is that?
Aloe vera?
Yeah, I know, but we use for
usually
the
it's for skin.
condition.
Yeah, but you can also get it in liquid form, and people drink it, and supposedly it helps with
It's good for the stomach.
stomach and complexion and things.
I think as long as you don't go overboard on it.
People cook with it too, I guess.
Yeah. I mean, as a food source, like if you consume that what would be natural as a food source, probably okay. as long as you don't go overboard and
Yeah.
And, yeah.
You didn't, would you mention and talk about cannabis?
Cannabis. So that's a very controversial topic, but a lot of physicians are allowing their patients to use it because it does help with symptoms. However, if you do smoke it, it does. If you're on if you have lung cancer and you're on certain medications like Tarceva or Erlotinib, it does reduce the effectiveness of Tarceva by smoking. So there are some certain drug interactions with cannabis. So I would talk to your doctor and see if they have any opinion on that.
It's related to NIH has been doing a very significant amount of research in cannabinoids, which is an extract of cannabis without the
Psychopathic.
effects. And preclinical and they're just starting clinical trials, but preclinicals or clinical studies have very significant impacts on tumor growth and the spread of tumors and even very serious forms of cancer. I was wondering if you had been looking into this at all, had any knowledge into that level of research, and who might be good doctors that could guide.
So I haven't looked into the research that deeply, but I don't know who would be a good doctor. I'm sorry, I don't know.
It's relatively recent. The preclinical trials have been over the last few years, but they're starting clinical trials. And a very significant amount of research has been done by the NIH.
Yeah.
If you're interested in any clinical trials for any cancer treatment, you can go to a website called clinicaltrial.gov, and then you can find any clinical trials that,
Clinical trials.
Yeah, it's like a government program where they list basically all the clinical trials that's being done in the United States. So you can see if there's any centers near you.
Is it harmful to take a higher dose of probiotics? Like I'm taking 90 billion, but you said between 10 and 20 million. Was it?
Well, it does it. So it depends on what product it is, because the cells are different. So are you using Culturelle also, or it's different between the products, so you can't really compare them. I would just go by whatever's the labeling on the product. Yeah.
Well, it says 90 billion, but is it way too much? Like, is it harmful?
No, if it's within the product labeling, it's fine. Yeah.
Can you use the product as a starter, making your own yogurt? Can
Make-
you use the probiotics as a starter to
Make-
make your own yogurt,
Yeah, you
which
can
is
make
easy?
your own.
I don't
It's a
know.
recipe.
Yeah, I do not know of that. I only mix drugs.
Let me in fact answer is that the mothers and grandmothers, they have been doing for millions of years, growing their own culture, and they have thrived fine. One of the things that I have been actually doing research on the herbology for the last 10 years, Ayurveda and all that, because I was a medical scientist back in India, and I became a software scientist. The thing is that the common denominator is really that we want to use like herbs as like medicine, not as medicine, but more as a food, like what these 14 herbs that we commonly grow, like the mint family, this coriander, this basil, and all these, the oregano and all that, if we use in small quantities and combine all of them, as much as we can do as a unmodified, means not try to concentrate and all, we are find many things that if we are actually using many of these herbs simultaneously, they are helping us in many different ways, and they will all contribute, even if they can reduce the disease by 10%, that's a lot, and without any side effects and all that. So that's kind of like conclusion of my research. So that yes, that people have been growing, and they can, I don't know what kind of bacteria they have, I don't know, but normally, even in this country, we still do the same thing, growing our own culture. Thank you.
Me?
Yeah.
I'd like to know if there's a safe source of supplements. Like,
So if you look on the supplements, sometimes they say USP certified, and those actually go through the United States Pharmacopoeia, and they're probably safer than the ones that don't have that USP label on it. Yeah. There's like a circle with USP.
so those
Yeah.
monitored, so
those are,
like half of the.
well, it's not as, well, it's not monitored from like the FDA level, but it's more monitored than the other ones. So it's more likely safe. Yeah. Yeah.
How about taking selenium, SCLE, and
Selenium. Selenium. What are you using it for? Is it? Or,
They said it's good to prevent tumor.
I mean, I haven't heard any like evidence that it does prevent any tumors. So I mean, if you're taking it for that purpose, it probably won't help too much. That's all I can tell.
The last 1.5 or 2 years is a lot of research going all over the world about vitamin D and how much is good and safe. And then they're coming out that more and more, the higher doses, the better. How far are we doing in Stanford research? They also involved in it, and because some of the doctors are using recommend quite a high dosage of the vitamin D. So, like I have a diabetic, and my doctor recommended 50,000 IU.
Yeah, you're taking it once a week, right?
And it's one vitamin store that he's working with, and I didn't have no side effects or anything like this, but supposedly it really helps the diabetic, plus also it gives you lots of support in any other parts of your body. I don't know how much research is going on here in Stanford.
I'm not aware of that specific studies going on in Stanford, but vitamin D deficiency is linked to a lot of disease, including cancer, cardiovascular disease, and mental illness. And so the 50,000 units once weekly is replacing the vitamin D. If your doctor checked your vitamin D level is turned out to be low, it's the extra treatment of vitamin D deficiency. So we do use high dose in that case, but to my knowledge, it's not recommended to use high dose people who are in the normal vitamin D level. So normally, like we do 1,000 to 2,000 units international units a daily. That's recommended dose. I've seen some patients using higher dose, 5,000 or even higher, but we do not recommend that high dose unless you have a diagnosis for vitamin D.
Right now you can see lots of places even the 5,000 in the bottles, and the very good places is not just like that you get anywhere. It's, I mean, areas that have whole food or a very good vitamin stores, but it's on the market for 40 years or 30 years or something like this. So, and then coming out with higher and higher dose in vitamin D. So that's how and it's all over the world. It's a big research now. About the vitamin D, that there's a lots of good in it. And that's why I was wondering that how much we following it in here to see the research.
I would be cautious to taking like high dose vitamin D because it can be accumulated. So I would work with your physician, make sure that you check that if you're diagnosed low vitamin D deficiency, check the level, make sure that your supplements dose is adequate to keep your vitamin D level in the normal range. But
what's a normal range in
depending on the
20 to 40.
Depending what units, but 20 to 40 is a normal range of vitamin D.
What about the usage of honey and olive oil to prevent tumor or cancer?
There are a lot of herbal supplements or any food and service it is studied and claimed to help the cancer, but I'm not aware any single big studies that proven that helps the cancer prevention or treating cancer.
What do you think about soybean and seaweed products? It's been, now they said that tofu is not for you, not good for you after all because it's so GMO, genetically modified.
Tofu? Yeah. So tofu is it has a soybean. It helps to prevent the breast cancer. And it's very interesting that tofu, the soy in food source, it helps to reduce breast cancer risk. However, soybean as a supplement is proven to increase breast cancer risk. And it's not in the human study, but it's improved in the animal study. So if you are high risk for breast cancer, and I highly recommend that you taking soybean as a food source, not as supplement.
But even in the food source, they said the beans are a high percentage of beans are growing in America are genetically modified, so it's not really natural to eat.
Well, if you're, I have to say, it's still better than just supplements. Soybean powders, and you have some soybean like supplements that you can buy at the health food store. And I do not recommend that if you want to use for breast cancer.
So it's the same way with seaweed, because there is a supplement on brown seaweed from Japan, and they sold for $330 for 120 kills. And then they recommend that if you are a cancer patient, you need to take from 10 to 20 pills a day. And
I think I would be, I would not recommend it because they spend so much money on those pills because first of all,
it's
you don't
called food
know
poison.
you avoid it.
Google and you can see it.
I just want to respond to this lady. If you're concerned about tofu that has too much GMO, whatever, go to a health food store and find one that says no GMO soybeans used in this tofu. I mean, it's got to be out there, and I'm sure you can find it if you look in those kind of places.
I have a question about tofu and soy products and estrogen-based cancers. The studies seem to be mixed. Some say yes, eat it. Others say no, stay away from it. So I stay away from it because I don't know what to do.
So women from like Northeast Asia, it's like Japan, or people from Asian people have a lower risk for breast cancer.
Right.
But however, when they immigrate to the United States, their risks are higher than people who are living in their countries. Mm-hmm. So the speculation is that it's probably from diet. And so as a pharmacist and as I have experience with herbal prescribing practice, and I do think that tofu in natural source is good for breast cancer. And if you are too concerned about, I don't want to take a chance, but the studies has stronger evidence that provide stronger evidence to have a positive in the lowering breast cancer risk.
Well, let's say for ovarian cancer, would it increase your estrogen levels? That was my concern. Will it increase your estrogen level? So my understanding is some people say it's good for ovarian cancer because the estrogen in the soy product will attach to the estrogen receptor and therefore occupying it, so that the body's estrogen won't occupy it. But then other people say, no, it doesn't matter.
I don't have any opinion on that, but in general, I think that I favor the patient to eat the good quality tofu if you have any risk for the breast cancer.
And how about the tempeh, which is fermented? Is that less estrogen? Do you know?
I'm not sure.
Yeah. Thank you.
Me?
Yeah. Yes.
Turmeric. What do you think about that for cancer?
Turmeric. I don't see the harm taking it, but I'm not sure that it's much efficacy in treating or preventing cancer. Yeah. Yes.
What about soy milk, like store-bought soy milk with a calcium add-in versus like buying just like this soybean like from Whole Foods bulk and making the soy milk out from the soy milk machine? I'm asking this question is because I'm trying to replace the milk with soy milk because there's been some studies, I don't know whether it's accurate or not, that milk promotes cancer cells.
Cancer cell. I think one thing I would avoid it that artificial like artificial, like supplements as a soy protein in it. Like there's the components called isoflavonoid, and it's one of the things that we believe that was important for preventing breast cancer. It's actually a harmful effect in preventing breast cancer. So whether soy milk versus soy, what is it, your
Soybean, like bulk soybean that you
natural
soil
source?
machine.
Is it from the natural source? Soybean?
Yeah, it's
from
just dry soybean.
I
think yellow color.
I'm not sure which one is better, but anyway, from the natural source is better than synthetic powder promotes breast cancer health.
You have any comment about soy milk versus milk?
Well, I'm a pharmacist. I'm not a
dietitian.
I'm not a dietitian, so no preference.
If I can address that question.
Yes.
I have a very strong opinion. The milk as such is not dangerous, but because there are like, whatever the hormones and all that go to the cows and all that, those have been injected. They definitely go through the milk and eventually in the human body. So those are the kind of like the issues with the milk. Otherwise, the milk is in nature's production, so-called. Though it's from a different species, that's still a problem. But if I were in her place, rather than using the soybean, I'll just take the hot water and put the soybean in that on ground without breaking it. So whatever the ingredients the nature will give me, I will just drink that. And I will depend on the nature that, 99% of the things which are not good for the health, they will not go into they will not each out, or they will not go into the water. So the water will be having extract of the soybean. I would rather depend on that. Same thing for the fenugreek and all that, for the diabetes and all that. That will definitely help. Anything that one wants to use, the best thing is to just put in the hot water as a wholesome substance and just drink that water. I think that's the safest and some effect, some help on it.
How long do you put in the water?
Just like 20 minutes, half an hour.
For vegetarians, would the advice on these supplements be different? For the vegetarian diet?
Vegetarian diets.
Would the recommendations be different for vegetarians? I don't think so.
No, I don't think so.
Is there any specific concerns you have, or?
Just generally.
No.
So, like a lot of things that go into like almond milk instead of regular milk. So is it better to eat the nut or to drink the milk? Because you look at the label of the almond milk carton, it's hardly any nutrition in there. So I'm just kind of like, what?
Perhaps if you need to drink, 3 quarts a day or something.
I don't have any strong opinions.
I do both. I drink the milk and I eat the nuts as a snack.
So milk thistle for liver protection, how effective is it for detoxification of the liver?
I think it's more of like a prophylactic type thing. So if your liver has already some issues, it may not work so well. But if you're anticipating some chemotherapy or something, it may be helpful in that way.
Supplements used in the traditional Chinese medicine?
Sorry, can you say that?
Supplements used in the traditional Chinese medicine? You said you have some expertise in Chinese medicine.
Chinese medicine concept of Chinese medicine are different from taking dietary supplement. Chinese medicine has a mixture of the different ingredients, and then also the way you process how ingredients are different, so that enhance efficacy at the same time. It's minimize side effects from all different herbal medicine. So I don't have any specific recommendation for Chinese medicine in this lecture, but the concept of Chinese medicine is very different from what we're taking it as a supplements and from health food store.
Any more questions?
So So does ginseng affect your efficacy if you're on a lot of prescription medication? Because that's a thing that's kind of going on within the Asian community, that if you on prescription medication, that when you take ginseng, you're supposed to space it out, like 2 or 3 hours after you take the medication.
Ginseng has stimulatory effects, so meaning that it can increase your heart rate, it can increase your blood pressure. So if you're diagnosed some sort of cardiovascular disease may affect heart function and blood pressure, it might not be safe to take it, especially at the same time that we're taking blood pressure or heart medicine. But in general, when you use it, has improved the energy levels and improved fatigue due to chemotherapy or due to cancer. It's probably safe, but I would work with herbal specialists to make sure that that's the right supplement for you.
So it's also recommended you take it during the day, right? If it improves your energy level.
Personally, I do not recommend buying ginseng from the health food store. Just number one, as everyone mentioned, the contents are not regulated. So even though you buy, like you said, 20%, and they may have like 10%, maybe 5% of ginseng in the capsule. And then second of all, and those people working in health food store, they're not healthcare professionals. So when they recommend it, they may not know that it's not safe supplement for you. So if you want to take a ginseng, I highly recommend that you talk to herbal specialists about that supplement.
This has everything you mentioned in it, and altogether 74 ingredients. What is your opinion?
What is it?
Green vibrance.
This was given to me by a man whose daughter, who is very sick, was taking it, and she only got worse.
Based on your previous experience, probably it won't be so good then.
Okay, so my opinion on that. So Chinese medicine, the mixture of herbs and how they process, it's been tested in thousands of years in people. So it may not have a strong scientific evidence, but it's proven to be safe if you have a good herbal specialist prescribing for you. For the supplements, a mixture maybe has all the good ingredients and mixed together, but it has more harms and the benefits, because first of all, the people who mix this, all the ingredients, they may not know how it's going to happen, what is going to happen, and after that mixture, all these ingredients together. Being a pharmacist, we all like looking at how drugs interact with each other. Sometimes one drug's working really well, the other way drug's working well, but if you mix it together, it causes more harmful side effects than its benefits. So I'll be very cautious in buying those supplements, especially very, very expensive. And I've been working, when I work at Cancer Center in Berkeley for 5 years, my day-to-day job was like having patients and asking about, is it good for me to take? And I oftentimes just giving more like concerns and agreement, and I realized that a lot of times people who are in the disease like cancer, people wanted to find the best type of treatment options, like including finding best doctor and finding best alternative medicine, best treatment options. And I realized that I would rather help them to find a better source, and I want to help them to how to use the right medication and the right timing. So I highly encourage all of you interested in the supplements or anything, and talk to your doctor, talk to your pharmacist. They may not have a strong opinion about certain things, but they may tell you that maybe not safe, or maybe wait until your treatment is finished, and then you can safely use. And I wanted to emphasize that the supplements promote treating cancer can be very expensive. I had some patients, and came to me and asked me the good supplements is the mushroom products, which is used for treating gastric cancer in Japan and some Asian countries. It is very expensive, but it's going to work for him, his cancer, not sure. And so before you spend $100 to buying all these expensive supplements, I would do some research and you ask some people who are maybe like more healthcare professionals that may have some knowledge on those supplements, and make sure that this, first of all, is it safe and to use, or is going to interact with your treatments. And that's what I want to tell you.
Since the FDA doesn't test these for what's in them, I've been told that the German equivalent of the FDA in Germany, they have to be tested. Do you know if that's true?
And herbal supplements in Germany is way more studied than United States. And I know that the pharmacists in Germany, they also have a much more knowledge in those supplements. So I believe that in Germany has more regulation on these supplements than United States.
Do they actually
test it?
Do they sample and test to see what it has what it says?
That's something I don't know.
Can I address that question?
Yes.
Please, if you would allow. Can I? Yeah. Germany has a Commission E, which they take the individual ingredients and then they test them rather than a combined formula. If I were to use this one, I wouldn't touch that. The reason being that anything that the nature has made, you can combine. You can combine 10, 20, 30 plants, leaves, barks, anything, that you'll be still safer. Once we have concentrated, then we have made it can help, it can hurt. So I hope I have answered your question.
Do you have an opinion about how to find a good herbal specialist, or is there a website that vets them out saying this has been, we know that he's
I know some cancer institute, they have
The NIH also has a section. It's how to find a practitioner. Yeah. So if they're registered with NIH, they should be able to find them. And then I think UCSF has a integrative medicine program. Not that I'm promoting UCSF, but they do.
Stanford doesn't have any.
They're trying to develop one, but as far as I know, they haven't finished developing it. Yeah.
Oh, quick question. Here you said the dose is very important. For example, in fish oil, 2 to 3 grams per day.
Mm-hmm.
Is that maximum 2 to 3, or you have to take at least 2 to 3 to have effect? What if I take 1 gram a day? That means I'm not doing anything, it's too little?
No, for fish oil, because are you taking it for triglycerides, or are you just taking it to help with it?
People say it's good.
I think the most well-studied are usually about 2 to 3, but I think 1 is probably okay. And then usually the max is about 4 grams a day. Yeah.
Is chocolate a good antioxidant?
I don't know. It may be good as an antioxidant, but it's bad for your blood sugar.
But it's good as a mood elevator.
Yes. But it's bad for your belly.
They also said 5 cups of coffee is good for you.
5 cups of coffee? I don't think so. That's a little too much coffee, I think.
Alzheimer's symptoms.
Yeah. So green tea can increase the levels of tamoxifen in the body. So you might get more side effect with the tamoxifen. Yeah. Yeah, it's just side effects. Doesn't neutralize it. It just might cause more side effects. Okay. Yeah.
Have you heard about, they say it's anti-inflammatory, it's called cat's claw, it's in the Amazon?
I've heard of it, but I don't know. I don't know. I heard about it, but I don't know much about it.
Can I answer that, cat's claw?
Yeah, sure.
It's an anti-inflammatory. Some ingredients in that, in fact, Germany's Commission E, it recommends it. And definitely it has some therapeutic uses for people those have osteoarthritis.
Sure.
This doesn't have to do with cancer, but
Okay.
say arthritis. I
Yeah.
heard there's a supplement, it's like chondroitin.
Glucosamine and chondroitin.
glucosamine. Are those,
Yeah,
do they help?
there's been, as far as I know, there's been 2 big studies with those. One showed that it helps, one showed that it doesn't help. So it's really not harmful. So
Come together or separate?
they usually come together, yeah.
Unless you have some blood sugar, are you diabetic?
No, it's not for me. I was thinking my mom.
Okay, so if you had any like blood sugar issues, you should say. Trust me.
If you have a blood sugar problem, not safe?
If you don't have a blood sugar.
If you don't have it.
Yeah.
What is it, glutamine, can you get them in a food?
They just said that you have to stay away from it if you have blood.
Yeah, it can raise the blood sugars a little bit in diabetes. Yeah.
What the first item on the list of gluten, is that, can you get that in what kind of food?
You can find it in the health food store.
It only comes in supplement form, you can't get them in any kind of vegetables or fruits or anything?
It's a pretty large amount, so I don't think you can get it.
So does that help with neuropathy as a result of?
It's shown to be helpful to preventing neuropathy, but once you have neuropathy from cancer treatment, I'm not sure that it's be effective. But study has shown to be effective if you use it as a measure of preventing.
So it also helps for the
Mucositis.
from the cancer treatment also?
Yeah.
It does?
Yeah, if you have like a lot of mouth sores or diarrhea.
How come your oncologist never mentioned?
Mine did. Mouth sores?
Yeah.
Absolutely.
Really?
Yeah, I gave you a strict mouth program to use.
He never did mention it to me.
Oh, not this particular supplement.
The supplement, the
They'll
gluten.
give you a prescription or something, but they don't tell you
No,
about the
I didn't
supplement.
get a prescription. He said brush your teeth properly and rinse
Well, he
with,
told me with the baking soda and salt,
water
but,
and-
you know, they said that the supplement will help with that, then they should have told us before. I'm already developing the neuropathy symptom from, you know, the oxycontin or F5FU actually.
So we can take glucosamine during chemo to help prevent neuropathy?
Yeah, you can, yes. But make sure that you take a 10 gram 3 times a day.
10 grams 3 times a day?
Yeah, so that's how the dose is done.
And after treatment, the most neuropathy is there's no sense of continuing it?
That's something I don't have any answer to. What is it called?
Neuropathy, but I don't know.
Oh, neuropathy, I'm sorry. Is it glutamine?
It seems like we live in California. Everybody seems to be vitamin deficient. Is it something that our bodies are not absorbing? But I came from a place during summer, I spent 3 months under sun, and I was still vitamin D deficient. So what happens? Is the range changed, or our bodies are not absorbing it? Or they're testing it more?
I think it's they're testing it, they're looking for it, so they're finding it.
Yeah, finding more deficiencies. Because vitamin D is not a common test that we used to do it in the past.
And the sun, don't we get it from sun?
Well, then,
There's been some controversy about it, so I think because there's a lot of skin cancer scare now, so a lot of people are putting on sunscreen, and then that kind of reduces the amount of vitamin D that your body makes. So then now, because of that, now everyone's vitamin D deficient, but then you can't really go in the sun because you might get skin cancer, and then so Yeah, you can never win.
We'll go ahead and stop the filming right now.
System does not.
But you're welcome to stay and ask more questions. But thank you so much for a wonderful informative herbal
Someone else still want to be.
Thank you very much.